Hi, I'm live from Amsterdam. I'm here at the 24th meeting of the European Hematology Association. I'm discussing today about the role of FDG-PET as a diagnostic tool in follicular lymphomas. FDG-PET is a functional imaging technique that has been acknowledged as a very important technique for most of the lymphoma subtypes that are FDG avid. In particular, it's been acknowledged as a required and recommended tool for response assessment in diffuse large B-cell lymphoma and in Hodgkin lymphoma. And in Hodgkin lymphoma has also been acknowledged as a decisional tool when performed after 2 cycles of chemotherapy. Follicular lymphoma is an FDG avid lymphoma subtype, and it's now been clearly demonstrated by several retrospective studies and also by prospective study that the quality of response assessed with the FDG-PET after standard immuno-chemotherapy is relevant because it is associated with a different probability of relapse and progressive disease after induction, also in the context of maintenance therapy. This has been initially demonstrated by a large cooperative retrospective analysis that was published by Judith Trotman in 2014, and recently looking at the sub-analysis of the Gallium trial, that is the trial that compared rituximab-based chemotherapy with obinutuzumab-based chemotherapy. It has been confirmed as an important prognostic tool because patients that achieved metabolic response behave at a reduced risk of disease progression after induction therapy. So as observed in other lymphoma subtype, this important information that we got with assessing the metabolic response can be used. There is a strong rationale to use this piece of information for guiding subsequent treatment. And this actually is being done by 2 randomized studies that are large cooperative studies. One of these studies is performed and sponsored by the Italian Lymphoma Foundation. Is named FOL12 study. In this trial, patient will be randomized if they have advanced stage follicular lymphoma. They will be treated with standard immuno-chemotherapy, and at the end of treatment, the post-induction management is decided based on response. Patient with PET positive, so with lack of metabolic response at the end of induction, are treated with radioimmunotherapy before starting standard maintenance therapy with rituximab. The second trial is named the PETREA trial. It's a cooperative study that involves UK and Australian lymphoma groups. And in this case, patients are treated with standard therapy, and they are randomized at the end of treatment if they are not able to achieve a complete metabolic response to receive standard rituximab maintenance or an intensified maintenance that consists of a combination of rituximab and lenalidomide. The Italian trial has recently been completed the accrual, and the data will be disclosed at the next Lugano meeting. And while the PETREA trial is at an earlier phase of patient recruitment, and both trials will tell us if the response-adapted therapy based on metabolic achievement of complete response is useful for the patient or not.